Hello, my name's Ian Shelton, and today I'm going to give you a quick video on IV insertion. So our patient today is a simulator named Bob, and he is being put under IV sedation for a dental procedure. Today we will review for the steps of IV insertion prior to anesthetizing a patient and administering fluids through an intravenous catheter. So as you can see, I have all my supplies in this caddy right here. What I'm going to do is I'm going to make sure that all my appropriate monitors are attached. Before administering a bag of IV fluids, you always make sure that your patient is connected to the appropriate monitors. That includes ECG, pulse oximetry, blood pressure, and because he's going under anesthesia, we are monitoring his respirations and end-tidal CO2. But most patients, if they're just receiving an IV for fluids, you don't really need the breathing monitors. You just need heart rate, oxygen, and blood pressure. So what I'm going to do is I'm going to make sure my caddy's in appropriate distance. So I have my caddy and then I have my sharps container. So what I'm going to do is I'm going to put gloves on. And since the patient's going under IV sedation, we have the patient breathing in a mixture of oxygen and nitrous oxide through a nasal cannula. We're going to now turn to the attention of the patient's arm. What we're going to do is we're going to tie a tourniquet approximately 6 inches above the antecubital fossa. And it's important to explain what you're doing. Okay, so I'm just going to tie a tourniquet above the area. You're going to feel a little pressure as I find a vein, okay? And I've already identified my patient. I made sure that it was Bob. I checked, made sure that the MIR matched the ID bracelet on the opposite arm. So now I'm going to palpate for a vein. You can dangle the arm. You can use a tourniquet. I found a good one right there. So I'm going to release the tourniquet while I get the rest of my supplies ready. So I'm going to take my saline flush. This syringe is filled with saline. And I'm going to take my extension set. This extension set comes in its package full of air. And in order to put fluid into the patient, we need to get the air out of the tube so we don't push air into the patient's bloodstream, because that can cause an embolism. So you're going to attach your saline syringe to the extension tubing, and you are going to prime 1 milliliter until it drips out the end, and you're going to leave this attached because you'll need the saline to check whether you're in the vein. So you're going to loosen your cap, but don't take it off because this end is sterile. This will screw right into the patient's IV catheter. Let me make sure I have our appropriate catheter size. Because the patient is having general anesthesia for a dental procedure, I'd like to get a 22 in this patient. You don't really need that big of a catheter if your patient is just having a short dental procedure. Where's my 22? Oh yeah, here it is. Here's my catheters. So you want to open up your IV catheter. And take the cap off of it. And then once you have your cap off, you want to inspect it for imperfections. This is a plastic catheter, and if there are any imperfections in the way the needle works, you could actually tear your catheter and release this into the bloodstream. So it's important to check the quality of your catheter. You have your extension tube primed with the normal saline flush, like we talked about earlier, and that is right here. Make sure that everything is within easy reach. Another thing you want to do is tear off some tape. because once you get the catheter in the vein and you remove the needle, you're only going to have one hand. So you're going to want to take this off, and I will hang it right on the edge of the caddy right here, so that when I need it, I can put it there. Then what you're going to want to do is you're going to want to get a Veniguard or a Tegaderm, which is one of these dressings right here. And this is going to be a clear adhesive bandage that will kind of go over the IV site to protect it and to keep it sterile. So it's going to look like this when you open it. You're going to have a little place for your date and your time of insertion. So let me fill that out right now. August 3rd, 19. And this is going to go over the insertion site. So, you have your tegaderms, you have your catheter, you have your saline flush, and you will also need an alcohol prep. Obviously, this procedure would be going a lot faster in real life. I'm taking the time to explain it, so it's taking longer for me to do the video. So, in real life, this should only take about a minute or so. Reapply your tourniquet, check your site while you can, because after you cleanse your site, you can't touch it. So you're going to open your alcohol wipe, and you're going to cleanse for 30 seconds, just as you would if you'd be drawing a donation at a blood bank. Zigzag, zigzag. You'd be going up and down, up and down, up and down. For a good 30 seconds or so. Okay, then what you want to do is you want to take your tegaderm and you want to set it down carefully to make sure that it doesn't fall and it doesn't get contaminated, because you'll need it once the catheter is in the vein. So, I have that right there. And you want to go in with your IV catheter, bevel up, and then warn the patient. You will feel a sharp scratch as I insert the catheter. 1, 2, 3, little poke. Poke. And it's important to let the alcohol dry. But once you're in the vein, you're going to apply pressure above where the catheter is. And you're going to use gauze. You're going to put it under the catheter like so. You're going to take your caps off. And you're going to attach it to the end of the IV catheter. So that'll be in the patient's vein. And then what you want to do is you want to take your saline syringe and you want to flush. You want to feel the site, make sure there's no tenderness or swelling or coolness, and you want to ask the patient if it burns. Burning, swelling, tenderness, those are all signs that the catheter could be outside the vein. And now, once your catheter is set in the vein and your chlorhexidine prep, or your alcohol, whatever you used, is dry, you want to take your tegaderm and you want to apply it over the catheter like a band-aid, and that will basically keep the catheter in the vein and also keep everything sterile where that insertion site is. So you'll take that off, and then you'll take your date and your time that you labeled earlier, sometimes it's hard to get it off. And you'll put it on the side of the dressing here. So you'll put it right there. And then, once you have flushed your catheter and made sure that everything's okay, then you want to take it off, and you want to bust out your fluids. The needle of the IV already went in the sharps container. You want to bust out your fluids right here, and you want to connect. Push and twist firmly. And then what you want to do is you want to take your roller clamp from your IV tubing set, and you're going to want to open that up to make sure that that IV is running good. And then you want to slow it down completely, stop it, and then slowly open it up while watching your drip chamber. And that's how you're going to find your rate. And then once that was done, you would turn on your pump, you'd start your infusion, and you would take your Coban and you would put it below the IV so that you don't get in the way of the site. You have to be able to view the site at all times. So it's good practice to use these tegaderms, and it's good practice to cover your IVs below the site. And then you want to clean up your mess, thank the patient, and then for a dental procedure where you use nitrous oxide during the IV insertion, you want to go to your anesthesia machine and you want to turn the nitrous completely off and turn on 100% oxygen so that the patient will have a lot of oxygen whenever you do sedate them with the medications. And that is how you insert a peripheral IV cannula.